If you've ever felt overwhelmed by the sea of PCOS supplements out there, inositol, vitamin D, NAC, you're not alone. With so much noise, it's hard to know what really works, what's safe, and what's just the hype. In this video, we're cutting through the confusion. We'll dive into what's talked about most when it comes to the PCOS world of supplements. We'll talk about what they're used for, and we'll just go through evidence-based practical advice to help you make informed, personalized decisions. First things first, will supplements cure PCOS? No. There is no magic pill. Supplements can support your journey, but they work best when they're combined with sustainable lifestyle changes. Think of them as a part of a bigger toolkit, not just a standalone solution. So first, without further ado, let's talk about the star of the show, inositol. You've seen it all over Instagram, and for a good reason too. Inositol is actually a naturally occurring sugar that's made in our bodies, and they're found in high fiber foods. There are two types of inositol: myo-inositol and D-chiro-inositol, and they're essential for insulin sensitivity. Studies show that inositol can improve insulin resistance, lower testosterone levels, regulate periods, support ovulation, and egg quality. What is the most effective form? A 40:1 ratio of myo to D-chiro-inositol. So common dosages are usually 2,000 milligrams of myo and 50 of DCI once or twice a day, and they need to be had for at least 3 months before reviewing its effects. Inositol has actually been shown to be as effective or nearly more effective than metformin with fewer side effects. It's safe, widely available, and often tolerable. Now remember, when it comes to the world of supplements, you need to speak to your healthcare professional because in some cases, metformin's exactly what's required for you. So please don't use it and please don't switch medications without speaking to your healthcare professional. The second and the most important, and one that is commonly overlooked, is the sunshine supplement, also called vitamin D. Up to 80% of women with PCOS can actually be deficient in vitamin D, even when we live in sunny countries. Low levels are linked to fatigue, mood changes, inflammation, and insulin resistance. Supplementing may actually help to improve fertility and metabolic health, even if you're technically not deficient. So get a blood test done before you start. Don't self-prescribe because vitamin D toxicity is something that's real, and aim for 10 to 15 minutes of sun exposure daily, obviously with sunscreen, and you can also add fortified foods, whether that's cereals, juices, milk, to your everyday. And then what about NAC? NAC has a powerhouse of antioxidants, also called N-acetylcysteine. This isn't formed in food, and it's usually a supplement that's derived from the amino acid cysteine. In PCOS, NAC can improve insulin sensitivity, lower testosterone levels, reduce cholesterol and the bad cholesterol called LDL, and it's been shown to support fertility and ovulation. Some studies show that it works just as well as metformin and with fewer side effects, and the dose is typically around 600 milligrams 2 to 3 times a day, but always check with your doctor. Then we have the anti-inflammatory all-star, which is the omega-3 fatty acids. They help support heart health, brain function, and cellular repair. You don't need to be consuming an omega-3 supplement. Getting it from your food is always important first. 1 to 2 tablespoons of ground flax seeds, chia seeds, walnuts, 1 to 2 servings of fatty fish a week, avocados, nuts, all of these are fantastic. If you do prefer a supplement, it's important to think about algae or plant-based supplements. Doses are usually less than 1 gram per day, and they're reviewed every 3 to 6 months. Remember, do not exceed your doses of omega-3 because this can also be harmful. Some of the other supplements you may have heard of, and we'll do a quick roundup of the rest. ALA. This is an antioxidant that can support insulin and reduce inflammation. We have CoQ10, which helps with energy, metabolism, and it's often paired with vitamin D. We have vitamin B complex, which helps to support metabolism and homocysteine regulation, which is important for insulin sensitivity. There's magnesium, which is often low in PCOS. It helps to improve sleep, mood, and insulin response. Then there's zinc, which can help improve insulin function and support skin health. Chromium, which helps to support testosterone levels, but it needs careful monitoring. And then we also have berberine, which is basically a compound that's plant-based that can help insulin sensitivity. Remember, when it comes to the world of supplements, it is not the more the merrier. Supplements can be powerful allies, but they are not a substitute for nutrition, movement, sleep, or stress. There is no one size fits all. You need to personalize your approach, track your body's responses, stay curious, but also stay cautious. Always check with your healthcare provider, especially if you have other medical conditions, you're pregnant, breastfeeding, or on other medications. And remember, that when it comes to supplements, we really need targeted supplement therapy. Some supplements may benefit you more compared to other supplements. Does that mean you need to kind of blanket approach and have all of them? Most definitely not. Your doctor may actually find it beneficial for you to focus on certain types of supplements that support certain types of symptoms or conditions that are associated with your PCOS compared to other supplements. And then let's talk about probiotics. I often find women start probiotics without any kind of guidance from their healthcare professional, but it's really important to understand that probiotics are not necessarily required by everyone. If you are consuming a diet that is whole food, plant rich, very well balanced, you may not necessarily require the probiotics. Probiotics don't help all individuals with PCOS. We know with regards to PCOS, the gut microbiome can be lacking certain diversity and certain bacteria, but that won't be helped by probiotics that are not targeted for specifically that. So speak to your healthcare professional if you would like a probiotic supplement or a therapy, or if you want to consider it to find out if it's the right option for you, because when you're considering a probiotic, you really have to look at the strain, the type, what part of their family do they belong to. You have to think about how many colony forming units there are. It's not always higher colony forming units equals better supplementation. You need to think about third party. You need to think about the quality over the quantity of the colony forming units as well. So rather than kind of blanket approaching yourself to supplements or probiotics or any other medications, please make sure you are speaking to your healthcare professional, because having an approach that's tailored to you is of vital importance.